Thank you very much, everybody, for connecting to this session. Today, we will talk about how we can transform evaluation to improve health and achieve the SDGs. So my name is Patrizia Cocca. I lead communication and knowledge management at the Global Evaluation Initiative, and I'm very happy to welcome you all. This is one of the 370 events that we are hosting this week in the framework of gLOCAL all over the world. So we are very happy to see you here. The mission of gLOCAL is to share knowledge, disseminate experience, connect people, and possibly inspire actions to transform evaluation and our world. So without further ado, I'd like to introduce the program manager of the Global Evaluation Initiative, Dugan Fraser. Dugan, the floor is yours. Thank you.
Thank you, Patrizia, and thank you to everybody for joining us today, and very welcome to you. Also very hearty welcome to the members of our panel today. We're talking about something that's a little bit out of the GEI's usual beat, and it's moving into the health space. As I think everybody on the call is very aware, the COVID experience has really pushed progress on achieving the SDGs way back. In many instances, performance has stalled or even been reduced, and in some cases, it's just slowed. But there's a general agreement that there has to be attention paid to getting the SDGs back on track. And one of the things we feel very strongly about is that evaluation can be one of the mechanisms used to improve performance of programs in achieving the SDGs. For us, when we talk about evaluation, and particularly in the health space, we're talking about a diverse set of practices. Evaluation involves the systematic collection, analysis, and interpretation of data, including monitoring data. And this is done to understand whether and how often large and often very complex global programs deliver in real life. And this is intended to give you an insight and a package of knowledge that's different to what you get from a clinical context or a research context. Evaluations do many things for us. They meet the purposes of accountability so that we're able to understand what's being achieved with resources that are being provided. They help us provide oversight so that you're in a better position to supervise the implementation of interventions. Evaluations can also be helpful from an organizational learning and a course correction perspective, and they can generally contribute to the idea of being evidence-based in terms of our practice. What we find in the health space when it comes to evaluation is that there's often a divergence between those evaluations in the health space that prioritize rigor, causality, and generalizability against those that are more focused on accountability, on course correction, and organizational learning. And this dynamic's important to recognize because we think that global health evaluation can do a lot to help achieve global public goods. It helps to produce knowledge about what works for development and mutual accountability, and it has the potential to strengthen governance of global public health systems. So now we find ourselves asking the question, how could evaluation do more to contribute to the achievement of the health SDGs? What innovations and reforms to governance, policies, practices, and methods are required to help us get evaluation into the space that it needs to be? And are there interventions that we could do to accelerate this process? Sorry about my throat. When we think about trying to make evaluation better suited to the achievement of the SDGs, there are a lot of things we can do. There are a lot of processes underway, and we need to take account of all of these things. So as part of this, we've assembled this panel. I'm going to hand over, Candice, I'm going to hand over to you a little bit early because I'm choking. But the idea is that we're going to have a conversation. We're going to invite each of the speakers to answer a question and take a round from them, and then we'll have a conversation. Candice, I'm going to hand over to you right now. Sorry, I was going to do the introduction of the speakers, but I think I won't get
Thank you so much, Dugan, and take care of that throat. It is the season where we are finding ourselves getting a little bit sick. So, of course, we've got this illustrious panel with us today, and we're really, really excited that you decided to join us today. And what I'm going to ask is for each panelist to introduce themselves just very, very briefly, so that we all know who's in the room. But I'm pretty sure that if you are in the health sector, you already know who these amazing individuals are. So I'm going to start off with James. James, please do your introductions.
Thanks, Candice, and thanks for inviting me to participate in this. My name is James Hargreaves. I work at the London School of Hygiene and Tropical Medicine, and my title there is Professor of Epidemiology and Evaluation.
Thanks so much, James. We will move over to John. If you may unmute yourself. John, just try that again. Okay, I'm going to move on to Nina. Oh, John, there we go. I know you've been having a little bit of an issue with your system, but if you can, please go ahead.
How about now? Is that better?
Yes, now we can hear you. Perfect.
Okay. Sorry for the delay. Yeah, John Grove. I'm the Chief Evaluation and Learning Officer for the Global Fund for HIV, TB, and Malaria.
Wonderful. Thank you so much. Let's move over to Nina.
Great, thank you. So glad to be here today. My name is Nina Schwalbe, and I'm the CEO of a think tank called Spark Street Advisors, and I'm on the faculty at Columbia University, where I taught evaluation before the pandemic.
Thank you, Nina. And then last but certainly not least, Peter.
Thank you, Candice, and hi, everyone. I'm Peter Hansen. I'm the head of results and learning at the Global Financing Facility for Women, Children, and Adolescents, which is a partnership host at the World Bank. Thanks.
Thank you so much, Peter. Thank you, everybody. So as you can hear, we are really in for a treat. We have a few questions to ask yourselves as the panelists, and we will then have, I think, about 30 minutes at the end for yourselves as participants to engage with the panelists, and hopefully we can have an engaging discussion towards the end. So the first question, and I'm going to just go in the same order that I did the introductions. James, to you, and everybody will answer the same question. How well does evaluation support global health financing institutions to achieve the goals described in the SDGs?
So thanks, Candice. I'll try and be brief. It's a difficult question to answer, though, and I wanted to just start by framing my answers in a couple of ways. So as I've said already, I work in a university. I'm deeply in the global health field, if you like. Most of my research is conducted in Southern Africa, and it's mostly to do with doing evaluations of approaches to improving programming for infectious diseases, and in particular, HIV. A big strand of my work relates to doing evaluation research in trying to understand better programmatic approaches that try to bridge the gap between having these incredible tools that we have in global health, whether they're treatments for HIV, antiretrovirals used as prevention products, or on the other hand, vaccines. And we all know that there's this enormous gap between the products we have and who has access to them. And much of the work I do is trying to understand programmatic interventions that can try and bridge that gap. And with that, I have enormous common cause with and work, in the research settings that I work in with the global health institutions represented on the panel here. But I'm an evaluative researcher. I've had a bit more of an insight into the evaluation world that we're talking about today, because I've for a few years now chaired the Evaluation Advisory Committee for Gavi. And so I've got, I feel very much from the research perspective, but with a little bit of this insight into the global health initiatives. I remain confused sometimes, and I know my colleagues on the panel, I've said this before, and sometimes people get frustrated with me. I remain with questions and curiosity about some of the distinctions made between research and evaluation as it's practiced in the more corporate sphere. And I suppose my overarching perspective is that I think there's a lot to be learned and a lot to be gained by bringing those things closer together. They often use the same methods, they ask very similarly phrased questions, and although the practice is very different, I think we have common cause across those endeavors. And so to come back to your question, I think it's very hard to answer how well evaluation is doing. What I can observe, I think, is what I think the things that I've been really impressed by in the global health evaluation space from my perspective as a researcher. There's an enormous political and symbolic importance attached to evaluation and throughout the system. And when I say symbolic, I don't treat that lightly. I think it's enormously important that evaluation has a very high priority place in discussions about how global health initiatives work. And you know, there are many different perspectives on how important international aid is, on the ways in which do we go about using development funds to try and influence the kinds of downstream effects that we want to have. And that symbolic and political importance is enormously important. I've been very impressed by. We could learn a lot in research from the management processes and the timeliness of the way that evaluations are done in the corporate sector. There's a caricature, I think, of researchers by kind of always being accurate but late, and that's something that's enormously impressed me in the engagement that I've had with the global health institutions and how evaluation is worked there. Two more things. I've enormously impressed also, and in slightly different, you know, it's different from the world I come from, the enormous focus on utilization focused evaluation. That's another thing that's sometimes absent from research based evaluations. We you know, it shouldn't be, and we might have much to learn, but the constant asking of the question, who is going to use these findings and what for? You know, sometimes there are questions that maybe we'll come to later about, you know, who the users are and whether we're always getting to the right users. But that focus, I think, is incredibly powerful. And finally, you know, I've also been enormously impressed by how much the sort of theory of change as an underlying tool to structure evaluation questions, to stay strategic, to allow, you know, people to raise questions and offer answers and interrogate the things that are difficult to interrogate. That's another thing that I've been really impressed by in the way that I've seen evaluation done. So those are the things that I see working really well in this space. Thanks, Candice.
Thank you, James. I think really important points, and I really appreciate the point of the unnecessary contestation between research and evaluation. Definitely something to talk some more about. Let's move over to John. Same question to you. How do you think evaluation supports, you know, achieving the goals described in the SDGs?
Yeah, thanks for that. And I agree with a lot of what James has said. I think the health sector has made huge strides when it comes to evaluation. I think also huge strides in program monitoring and evaluation, M&E, general M&E, in being able to really robustly make a case for resources and continued focus on performance. I guess I would say a little bit more critically, though, when I look at evaluation specifically and looking at how do we get below the averages, or the tyranny of the averages, I forget who coined the phrase, but you know, where I think we may have not, where we've had a bit of a lost opportunity is really in leveraging the learnings from evaluation. And it's easy to say, and it's easy to sort of sit around and say, well, we need to learn more and disseminate more. But I really do think that we could be doing a lot better job pulling the insights from the independent evaluations and matching them with some of the trends and findings of program monitoring and other kinds of analyses to make a better play when it comes to insights. Because I feel what we're losing sometimes is just the experience of care at the local, subnational, and national level, or the experience of access to care and service delivery, which sometimes gets washed out in these large reports. And so when I look at our agenda at Global Fund, there's been fantastic work done in the past when it comes to independent evaluation, prospective evaluations at country level, but at the same time, the ability to harvest all of that in a way to bring it back to informed decision making and to really provide another voice for the people we're trying to serve is an area where I think we can use evaluation a lot more effectively. I think the other area that we need to be really borrowing from is someone else already mentioned, the private sector and the business models of doing this, is really the more of an openness to critique and critical reflection within organizations. And I think that's something that is not always thought about when we're thinking of evaluation studies, but when we think about the processes that we need to put in place within organizations or across organizations, building that openness, building those fora for that kind of critique and reflection is really important. And unfortunately, I've seen a bit too much maybe using evaluation in a I don't want to say weaponizing it, but as a way to kind of, well, we can't figure out this political problem, so let's throw an evaluation at it and try to figure it out that way, and avoid some tough conversations. And so I think the evaluation community has an opportunity to be pushing for the right placement of evidence in the right conversation, but also to be able to say, this is actually where the helpfulness of the evaluation stops, and this is where, you know, the role of policymakers begins. So I think these are a few points. I mean, one just around leveraging it better to paint a picture of the experience of care and service delivery on the ground, and secondly, using it to really push for more critical reflection and driving those tough conversations. It's easy to say, but I think it's possible if we're joining forces and against some principles. So that's what keeps me awake at night, I guess.
Thanks, John. Really intriguing point around the potential misuse of evaluation as well. But I really loved what you said about learning, and I think these conversations have come up over and over about, you know, that push and pull between learning and accountability, which is it? And I think again that's that false dichotomy of those two. How do we pull both together? I'm moving over to Nina. Nina, your thoughts on that same question: how evaluation actually supports global health financing institutions to achieve these SDGs for health.
Great, thank you, Candice. And I think I'm gonna focus a little bit on what can be improved as opposed to what's already good, because I think as evaluators, that's also often where we land in a conversation. So I think it's mixed, and I think probably not as well as it should. I think as John alluded to, I think there's really a fear of honest feedback by these global health institutions. There's a lot of money on the table. People are trying to convince their donors. So fear of honest feedback is a problem. And I think as many of those of us on the call have discussed, there's also a big capture by the firms that are doing evaluations in our space, and they have competing interests. They have multiple clients, they have ongoing relationships with a particular client or within the ecosystem. So that really doesn't help. And what that leads to is a lack of independence in our field. And what do I mean by independence? I mean, really freedom from external influence, control, and pressure. And I think we've done a little work to kind of really draw that out. And for us, that sort of has four characteristics. And one is financial. They're not financial. A lot of the evaluation done is not financially independent because it's tied to doing a good job or to other clients that they may have. And financial independence is a critical aspect of independence. Technical independence often, and I have done evaluations, advised evaluations. Often as an evaluator, you're not actually empowered to get the information that you need. You're controlled who you can talk to as an evaluation, very controlled. You're given a certain number of interviews, and the global health organizations really want to manage who you talk to, or even access to their books, and how difficult that can be for evaluators. I think it's hard to have operational independence in that tight timelines, forcing into inception reports and draft reports. So there's a lot of freedom to operate can be constrained. And then back to this question of political and protection from influence. There's so much capture in our field, and there's so much interdependency in the field of global health that it's hard to disassociate yourself from political influence. And the last point I'll make is on that is, I just did a lot of work on the pandemic treaty. And I think there's been so much attack from anti-globalization people about pandemic treaty bad. And I think we had a lot of trouble articulating pandemic treaty good, maybe this one could use improvement. And I think evaluation for these big GHIs suffer from the same thing. You know, global fund good, room for improvement. So those are a few thoughts about why I think something needs to shift in how we do this. Thanks.
Thanks, Nina. I think it's important that you shifted our attention also to the stuff that's not going so well. And I really think that sometimes some of these bigger systemic issues almost seem insurmountable, but I think that naming them and seeing what we can do about it is really important for evaluators. Peter, over to you. The same question. Your thoughts on how evaluation actually supports the achievement of SDGs for health.
Thank you, Candice. I think evaluation plays a really important role, centered on both the learning and accountability, as others have noted. I think if we imagine a counterfactual with no evaluation functions within our organizations and no advisory bodies overseeing and guiding these functions, clearly these institutions would miss many opportunities to learn and improve, and accountability would be very significantly weakened. It's an understatement, and in fact, an egregious one. It would be much more than a missed opportunity. It would be a failure to achieve the mission that is the reason these institutions were created in the first place and why they are supported with precious financial and political capital. Of course, merely having these functions within an organization and having the advisory bodies by itself is not enough. Clearly not a box or a couple of boxes to be ticked. These need to be active and effective functions with strong support from leadership at the board level and within line management, going to the top of each institution. Resourcing needs to be adequate, and there needs to be a cultural and political environment that values evaluation, assures independence, as Nina and others have noted, taking into account the different elements and types of independence that need to be fulfilled, while also capacitating the function and actively supporting the uptake and use of the findings, irrespective of whether those findings are positive or negative, easy or challenging. I think everyone is ready to take up and use positive findings and easy findings, but I think it's the negative findings or the really challenging problems that require the full exercise of that commitment. I think with those elements in place, it is very clear in my view that evaluation can play a critical role in helping these institutions to fulfill their missions and maximize their contributions to the SDGs.
Thanks, Peter. I think also you mentioned a couple of critical issues around what we could say is maybe institutionalization of the evaluation function, or better or deeper institutionalization of it. While at the same time, just reflecting on what Nina spoke about, that with that institutionalization could come what we say teleological approach to evaluation. So it exists just for the sake of existing. So I guess it's almost balancing those two, that yes, we have to focus on institutionalizing it, but at the same time, it's not just a tick box matter. So moving on to the second question then, what needs to change? What needs to change in the way evaluation is done in global health financing institutions that it better serves their goals? And I'm going to go back to James. James, your thoughts on that?
So thanks, Candice, and thanks, colleagues. I'm glad that my colleagues moved quickly to the business of identifying some of the things that could be improved. And so I hope you'll give me the leeway to use a little framework that I've been using for a little while now, when in my world talking about what I see as the big challenges that those of us who want to see a world in which we're able to operationalize rigorous evaluations in the real world that are useful, the challenges that we overcome. And I use this acronym FURRIE, which I've shared with the colleagues on the panel before. FURRIE stands for, it's F-U-R-R-I-E, FURRIE. And I'll just go through each of those words. I'll say what the letter means and just say a little bit about how that framework kind of helps me think about some of the things that I see could be changed. So F is about feasibility. It's about just getting evaluations off the ground in the first place. And here I think, for me, the global health institutions have a colossally important role in having the potential capacity to enable learning through evaluation at all levels of the system, from what goes on in Geneva secretariats down to what goes on in country programming. And, I don't think it can be overstated how powerful their voice is in fostering that, and how important their role could be in creating an environment where evaluation is cherished, critical evaluation is cherished throughout the system, and we do these evaluation studies and learn along the way. I think they have a critical role, and they could play a bigger role in that. I don't think it's valued as much as it could be, you know, in the blurb for this session, we talked about the idea of the value of trying to get to triple loop learning, you know, teaching organizations to learn how to learn. Now that's a long journey, and we need a huge number of people putting their shoulders behind that. The GHIs have a really powerful role in potentially doing that all the way through the system. So that's F about feasibility. U is about usefulness, or utility is the language used in the space we're talking about. You know, as I've said already, utility is colossally prized in the evaluations that I see amongst the global health institutions. I guess my question, what I sometimes see is useful for who? And I think there are, where I see both uncertainty in my mind about whether the evaluations are useful performatively, you know, just because they're there, as been talked about there. Are they useful for the boards and the donors in making decisions? Are they useful for the secretariats in course correcting and changing programming on a short or a longer timeline? Or are they useful for countries in helping to deliver the programs that actually get the, you know, the products into people's arms and the, you know, the pills into the right places? And I as I've said already, I think that more could be done to make the usefulness better down at country level, as well as that focus further up the chain. The first of the R's is about rigor, and it won't be surprising to anybody that as a, you know, professor in a university, I think the methodology standards of all of the evaluations that I see could be improved. And I recognize that, you know, I've already said researchers are often, you know, on the end of this criticism that we are getting ever more accurate answers to questions 3 years down the line. And I recognize that tension and have been impressed by the, you know, the speed, but that can't be at the expense of jettisoning rigorous methodology. And what's going on in these evaluations is fundamentally a research process. It's about collecting qualitative and quantitative and documentary data and applying an analytic lens to those data. And we need to make sure that we can draw a very straight line between the data that are assembled, the conclusions that are drawn, and the recommendations that are made. And I'll just also mention here that independence is a critical part of that. You know, I see independence as a necessary but insufficient part of the pathway to rigor. You know, getting the right answers and conveying the right answers to the right people. The second R is about keeping things relevant, and I think that's maybe one that's least relevant here. That mostly that's about trying to ensure that the architecture that we bring from the research process, which is often imported from clinical trials, doesn't ruin our capacity to learn about the real world. And I think that's maybe a less of a concern in this space. It's often a concern in the research evaluation studies that I'm involved in. I is about being informative. It's about making sure that there is a rich description of the processes and the procedures that underlie these evaluations. Very often that we're talking about process or impact evaluations. We're trying to understand how implementation and processes work in practice. Where can they be improved and made more efficient? And for people to learn from those things, you need rich description of those things. I think that is true in the evaluations that I see in the global health initiative space, but I wish they were shared more widely, or at least made more accessible to others. I think abstracting and bringing those, you know, those thick descriptions into the broader literature, the broader learning space, the broader evidence base would also be enormously valuable. And then finally, E is about equitable partnerships, and that's kind of been also touched on a little bit already. I mean, I think that's going to be one of the big shifts that happens over the coming years. You know, the future of global health initiatives that has recently been undertaken by the governments of Norway and Kenya with the Wellcome Trust, I think is one of many things pushing us towards really thinking about who is evaluating who, for what purpose, for what learning, and ensuring that we retain independence, but also that we get the partnership right, we get the learning in the right place, we get the right people setting the questions. That really is something that there's an enormous amount of learning to do, both in the kind of research I do and also in these sorts of, in this space. Thanks.
Thanks, James. Really important points there, and especially that last one, you know, and that question around whether independence is at odds with, you know, localization or local learning agendas. And I think that's a huge point that still is, you know, there's a furriness, I may use your pun, around that particular matter. John, let me move to you. The same question to you. What needs to change? And if you may unmute again, I think that you need to just click the unmute button. There we go.
Can you hear me?
Yes, thank you.
Can you hear me, Candice? Good, sorry about that. Yeah, I agree with what James has said, and I've always liked the furry framework. I think it's useful and simple and easy to apply and very rich, I think. I guess my view is in sort of three areas in terms of what might need to change. I mean, I started off by saying, well, there's this passive environment of avoidance or allergy of critique, but that's a two-way street, right? And so I think first kind of response to that is that we also, those of us in this field, have to continue to prove the value of independent evaluation, improve the value of the processes, improve the value of good recommendations. What do good recommendations look like? What do good findings look like? Strength of evidence. And so it's really also on us to prove that value, because you're not going to. It's very easy for stakeholders to, if they don't like the answer, to quickly say, well, the evaluation was no good. But if you put the right things in place to prove the value, or to, whether you're doing a quality assurance exercise against that evaluation, or you're running a wholly transparent process with very clear steps and SOPs, there are things you can do to make sure that the value proposition of evaluation itself is brought forward very clearly, so people kind of muck in with the process, and they're contributing to it, and they're part of the solution. And so that's on us, I think, as a profession, to figure out that balance. And I always come back to a framework I've used where evaluation specialists or leaders or associates, contractors, whomever, have a dual role of being sort of an instrumental role and a facilitative role, where the instrumental piece is a lot of, and I think this overlaps with the furry, James, but the pieces around the rich description, the pieces around the rigor, around painting that sort of beyond the shadow of a doubt picture of what's going on, and then the facilitative piece being engaging the stakeholders in the right way, in the right phases of the process. So I think that is just an ongoing piece of work that we have to be constantly pushing up against and being critical with ourselves. I think the second is also structural considerations. If we look across the GHIs, they're not consistent in terms of the structure of evaluation or results monitoring, planning, or learning, and that's fine. But I think it would be interesting to look at how different structures may provide different value to different ends in the process. Global Fund right now, we're an active experiment. We're an independent office, but we sit within the Secretariat. We report to the CEO as well as the independent evaluation panel and our strategy committee, but we work every day with our colleagues to try to make the evaluations as useful and relevant as possible. And I can't say that it's I don't know yet, if it's the right approach, but I think we should be having those discussions about, what's the right structure look like, and what are the pros and cons of how things play out. And then I think the last piece is around the marketplace itself of vendors and supply. We're really being quite intentional with trying to really find partners that are based in lower middle income countries that have really good understanding of the context. Our feeling and belief is that the talent is there. It's the barriers to entry to working with our large institutions which really need adjustment. And our whole group here on the call has had that discussion a few times over. So that's I think a passion for all of us. How can we engage partners and reduce our barriers to entry so that we can move the marketplace? I think Nina mentioned that as well in her opening. So I'll stop there. Thank you.
Thanks, John. I'm really enjoying your reflexive sort of bent on the questions, because I think I'm thinking about on triple loop learning that was mentioned earlier on. So it's sort of the intentionality of us as evaluators, not just being part of the evaluation machinery, but really sitting back and thinking about, what impact is what we're doing and how we're doing it and how we're building it. So that's really intriguing. Nina, the same question to you. What needs to change?
Great, thank you. I mean, I'd like to come back as well to this idea of engaging further partners particularly from the Global South, because I'm not sure, now I've seen that happen, I'm not sure it answers the sort of question of independence. So I think some of with many of the institutions that the global financing, the evaluators engage, there's still the same questions of capture. So I think it would be great if in the end we could come back to the little bit and around sort of the decolonization question in general. But from my perspective, there are a few things that need to change in order for evaluation to better serve the goal. And assuming that the goal is not more money or further financing, but the goal is actually to increase equity and access to products and services in healthcare. I think global health institutions to be a little bit less fearful of criticism and not afraid of challenge. I think they're very worried about anybody challenging them. And that means that the evaluators and the evaluation advisory committees that are set up really have to be firewalled from the political pressures. And that means, maybe then it means not doing Gavi's big evaluation 2 months before replenishment, if people are really that afraid of what an evaluation is going to say. So this idea of firewalling from political pressure and having these GHIs really be able to sort of step up and take it a bit on the shoulder, I think is going to be critical. I think the other thing, and everybody on the panel has alluded to this, is thinking through how organizations incorporate learning. We just did a review, and thank many colleagues on the phone who talked to us, but there are ways I think learning can be done better. I think a number, and not speaking to organizations on this call, which have a lot of best practice, but many organizations that we looked at say they do learning, but few take a really intentional approach to how findings are used. They focus in their policies more on how information is collected, what the monitoring systems are, and less on how they're going to make that play into action. The tools that different organizations use a lot, and I think we saw there's no best one way fits all. That the kind of learnings that people use are really specific to the context, and there's no right way. And I think that two other big lessons from that were that more is not always better. There's a tendency of organizations to collect a huge amount of organizational data, that these evaluations can be huge and long. And I think James alluded to that about how do you target the audience with the right information, but 800-page with annexes, sometimes, and James also alluded to this sort of distinction between review and evaluation, but sometimes what we noticed is it might just be simpler to do an open-ended question to a few people as opposed to sort of the huge learning exercises that people go into. So in summary, that's about really being purposeful about when organizations are collecting data, really thinking through in the end how exactly those data and that information will be used. Thanks.
Thanks, Nina. And again, I think that raising again the complexity of the challenge, that it's not really a simple answer. And I really think that, again, talking to the fact that we shouldn't just feed the evaluation machine. It's not just about producing more and better evidence. There are some other things that need to change and transform in the system as well. Peter, over to you, your thoughts on what needs to change.
Thank you, Candice. To complement important points raised by others, I'd like to highlight two key areas where I think change is needed. The first is on the role of country leadership throughout the evaluation process, and the second is related to the time horizons through which we operate in the evaluation space. On country leadership, I think in my mind, it's very clear that we need more country leadership, grounding, voice, and decision-making throughout the evaluation process, starting from setting the agenda in the first place. What is evaluated, where, and how? I think that does entail a shift in power and influence over the evaluation agenda from those outside of countries to those within countries. Obviously, that external role, including within and around the institutions, global health finance institutions, is still critical. I'm not underestimating or downplaying that part, but trying to make a case for elevating the role of country leadership in relation to that process. And I think some of the key elements required to fulfill that are, number one, for institutions to involve countries more meaningfully in the decision-making process around that agenda, to anchor their work in, or even at minimum, as more of an incremental step, to link their work to units at country level that are usually within governments or sometimes parastatal or state-affiliated institutions that are mandated with leadership and coordination responsibility for research and evaluation, maximizing the role for local research and technical institutions, as noted by others, and linking that to an elevated leadership role for countries more broadly. And another key element, which I think is very important, is working through existing fora, such as national coordination platforms that engage stakeholders in an inclusive way throughout an evaluation process. In many countries, these platforms are convened in a framework of government leadership, but it's very critical that they be inclusive of stakeholders outside of government, including civil society, youth organizations, private sector, development partners, and so on. And then maybe perhaps more briefly on the question of time horizons for evaluations. I think in our field, there is a legacy where evaluations tend to come too late, they're too lagged, and they are too often disconnected from what is currently happening. So the key question for me is, can we shift processes and approaches to better align the time cycles across each stage of the evaluation process with real-world decision-making needs? In so many cases, when an evaluation report is finalized and disseminated, the response from intended users is, this whole exercise would have been a lot more useful if the key outputs were available to me 1 year ago, or perhaps even 2 years ago, or 5 years ago, in some cases. Can we build an evaluation from the beginning rather than making an afterthought? Can we shift to a more prospective, forward-looking orientation that is current and timely? And can we use and support and reinforce feedback loops that actually work to provide knowledge and evidence to decision makers when they actually need it and can use it to make timely decisions and adaptations after the fact? Thanks.
Thank you, Peter. So not as fast as James has portended us to be in evaluation. But certainly, I think one important point is on country ownership and country leadership. I think that's a conversation that's really happening, this tidal wave of those conversations happening, I think, in multilateral development banks at the moment. So I think a really important point about how do we make sure that, we don't lose accountability. Of course, there are requirements for compliance, while at the same time, again, that false dichotomy between that and localization or local leadership and ownership of evaluation processes. The last question, I'm going to try to see if the panel can go maybe a minute or minute and a half each, so we can give some opportunity to the participants to engage as well. There's some questions coming up in the chat, but we will also, to yourselves as participants, perhaps allow 1 or 2 people to voice their question to the panel. So last round, first of all, to you, James, how do you think change is best initiated and supported in these GHIs so that evaluation becomes more useful?
Thanks, Candice. I will try and be quick. I mean, I think I have one very short answer and a slightly longer answer. I mean, in part, the short answer is I think, that is part of the role of the advisory groups that support these organizations. I think it should be their role to avoid capture. And Nina is absolutely right. Those issues are out there, but to be able to provide independent advice to and critical reflection with the organizations to help them think about that. So that's one answer. And then the second thing, I mean, I think I'm just going to use the opportunity to mention an idea that everyone on the panel knows is in the air, and we're interested to hear what people who are attending think about. I'm aware, as I've said already, I'm slightly outside of this system, not because I'm outside health, but because I'm slightly outside of the sort of central evaluation in global institutions space. I'm aware, though, from the work I've done in the last few years, that there are a whole load of conversations about transforming evaluation and a whole variety of issues around that. So what I say now, I have had doubts about, but one conversation we've been having for a while is whether the idea of a Lancet Commission on evaluation related to the health SDGs would be a useful process. And just to quickly, so people here know what that would mean, the Lancet, I'm sure you all know, is a prestigious medical journal. Lancet commissions take pressing issues in global health, and they assemble a group of commissioners. These are usually relatively lofty individuals to conduct an evidence-based, it often involves some primary research process to really go at a particular issue in global health. This would be an unusual topic, I think, for a commission. They're often about particular health areas, types of cancer, blindness, etc. But this would be a more methodological focused. And the they're in the health area, at least they're quite influential. They get good engagement, and so that's one idea, is a thing to move forward. We've talked a little bit about what the form of one might be, at the very highest level, perhaps a year of recognizing that this evaluation space in health is very varied and involves many stakeholders. And so an initial phase of mapping and consultation, followed by a second phase of sort of ideation and thinking about what do we really want an evaluation ecosystem to look like, and then that leading to some recommendations and some trial that would go forward. So I'll leave that as a process that might move us forward.
So much, James. That's really exciting. We all understand the gravitas of the Lancet. So if that could happen, I think it will really push the agenda forward. John, same question to yourself. How do you think change is best initiated?
Yeah, I think a few immediate things can be done, and some of these I think we're already working on as a group and talked about. One is really coming back to some earlier comments around the what I think of as the marketplace, shake-up, and really looking at what we can do to reduce the barriers to entry in terms of different firms and groups becoming partners in terms of doing evaluation work, learning facilitation, other kinds of analytics of the similar type. And so really looking at more information to different groups earlier, having more communication pre-bid, trying to explain our institutions a bit more with folks who are looking to bid, and looking at other kinds of proposal development or other opportunities, and also being willing to place some bets, in terms of groups that are emerging and really have a lot of potential to scale on more of a regional or global basis, and looking for those rising stars. And so that's something that we're all talking about, doing some mapping together and identifying those capabilities, because we believe they're there. We just need to rebuild some of the framework around it so we can work together. And then the second is sort of a businessy buzzword, but around the whole area of optimization of what we're doing. I mean, I think Peter mentioned this as well, just around the timing of things. I think there's a lot we can be doing to ensure preliminary results are provided sooner. Okay, it's a reality. It's going to be a 6 to 8 month evaluation, but if we have some preliminary findings that can support some decision making within a team, within a policy, within an investment design one, let's get those preliminary results earlier, and let's recognize the incompleteness, but we have enough information to know that the weather is trending in a certain direction. So we're building that into a lot of our contracts to get earlier information to stakeholders. I think the other thing is also paying attention to our own resource use. One thing my team I think gets annoyed with me, I tend to quote cost of evaluations in terms of bed nets. Okay, well, we can do this evaluation, or we can buy 400,000 bed nets. So it better be worth it. And it's tongue in cheek a little bit, but it's true. We are in some cases dispensable when it comes to the trade-off with providing life-saving tools and services. And so let's make sure we're doing this as feasibly, as tightly, as focused on scope and decision as we possibly can. And that's obviously a work in progress. I think the last thing I would mention then is also in terms of optimization is looking at what other non-traditional partners in global health or global health evaluation can provide. So discussions with Cochrane, for example, on evidence reviews that have already been done, where we have enough information to be able to say something about something. We don't need to go and cut a new piece of primary work or folding that into our scoping work. We'll be doing a session at the Global Evidence Summit in Prague in September, trying to create a conversation between the evidence synthesis folks and the independent evaluation folks to see if we can cook up something to a framework or some principles. So I think there are some other little corners that we need to be reaching out to and pulling into the sandbox. So thanks.
Thanks, John. I think really, really practical levers, but very strong ones. I think that can be catalytic if we can push those, especially around the optimization. I 100% agree with you there. Nina, your thoughts on how you think change is best initiated and supported?
Great, thank you again. I mean, I think for the board has to ensure that evaluation is independent. They need to be on board with the utility of evaluation and not afraid of change or challenge. So that would be my recommendation to the boards of these organizations. To the evaluators, stay the course, focus on the findings, not the recommendations. Evaluators are good at diagnosing, but in terms of what comes next, really work with the organizations themselves to figure that out. And for the organizations, they need to invest in learning at all levels of the institution, from the board to the individual, from the individual to the board. So those are my three kind of very concrete recommendations. I think the other thing I would say is to John and to Peter, and I guess to James to some extent in his role, I think it's really important that we don't call things independent that are not. Dependency is okay. And I think when we manage risk and we manage conflict and we manage conflict of interest, sometimes we have to say there are dependencies and here's what they are and here's how we manage for them. But I think I've noticed as an outsider that these global health institutions sort of hide under, oh, it's independent, when, you know, as I talked about, if we use criteria of independence, political, financial, technical, for example, I think if you looked at it, they're not, and that's okay, but let's recognize it and manage for it instead of sort of calling it something that it's not. So those would be my advice to those four groups. Thank you.
Thanks, Nina. And I think independence has come up consistently in today's panel and even in the chat as well. Some people have some questions around that. I really know it's a really difficult issue because we talk about independence, yet you also say we have capture. So how are those things working out for us? A really, really important issue. Peter, your thoughts on how you think change is best initiated and supported?
I think, like a lot of things in life, probably most things, that the aspect of change coming from within is really important. I think institutions need to be committed to evaluation in a very serious and principled way, including openness to change and challenge, as others have noted, at the top of these organizations and throughout. And as I tried to articulate earlier, not just, and others as well, not just commitment to having a function exist, but one that is strongly supported and enabled, adequately resourced, with political commitment and assurance of independence where that is needed. Also, just like quickly echoing Nina's point that we should not be calling evaluations that are not independent or which don't need to be independent evaluations, right? Sometimes, particularly where learning is the primary objective, a non-independent approach might in fact be more suitable than an independent approach. So I think maintaining that clarity and all aspects of the definition, I do think, is critical. As others have noted, the role of the governance bodies is critical. I won't elaborate because I know we want to leave time for discussion. Others have spoken to this very, very clearly and compellingly. The boards, the committees, including the evaluation advisory groups, without question, I think one of their main functions is to make sure that the evaluation functions are operating in the way that they're intended and that they are improving over time and changing when they need to. Role of countries is critical as well. I think it's so important and so helpful for countries to use their power and give voice to their demands, how they see their role on the global evaluation agenda, how they see their role on the in-country evaluation agenda, how they expect things to work in a way that recognizes and reinforces that role. Partner collaboration, I think, can help a lot, exchanging on practices and experiences, identifying what others are doing or could be doing, which may be useful, trying new modalities of partnering or collaborating on something, I think can be an important part of a change process. And last but not least, I do think broader accountability mechanisms that cut across multiple institutions can sometimes and in some areas be very helpful also for catalyzing change, particularly when more accountability is needed. Over from my side, thank you.
Thank you so much, Peter. Ending that round of questions with a very strategic set of recommendations. And we have almost no time left for discussion, but I think we might be able to manage one hand. And so I'd like to ask from the audience, we will be able to note, and we might only be able to pick one person. While we're waiting for that, I will see what's happening on the chat.
Candice,
I know a couple-
the session runs for another half hour, so there
Oh,
was
it
a
does.
misunderstanding.
Oh,
Yes,
fantastic.
it was
Okay.
originally scheduled for 60 minutes, but it's actually running for 90 minutes. So
Oh,
we've got another
fantastic.
half hour.
Oh, what? That is amazing. Okay, I'm a very happy moderator right now. So colleagues, participants, please do feel free to raise your hand. We do have an opportunity for you to actually voice your question or comment to the panel. And while we're waiting for you to settle your thoughts and think about what you'd like to ask, I will go through some of the questions that have come through on the chat. I know in the Q&A, there are also some questions that have already been responded to. I think it is quite vibrant. There's a long conversation happening over there. Dugan, I see your hand up. Is that an old hand, or you'd like to come in again? Oh, okay. That's
No, I'm trying to fake being a well-behaved participant. So I want to riff a little bit on something James was talking about, which is this idea of a Lancet panel, a Lancet commission, and I do see the comment that somebody put in the Q&A saying that these Lancet commissions are all well and good, but they tend to be the same bunch of recycled cronies. And would it be possible to have a more diverse commission if one were to put one together? And so let's imagine that we're talking about a very diverse panel of people appropriately selected from outside the usual suspects. And I'm going to ask Patrizia to launch the poll that we've agreed. We simply want to know if you think a Lancet commission on this question of how to make evaluations more helpful to the achievement of the health SDGs would be useful. And if you can answer, we, the panelists and the hosts, can't vote, but if you could take the opportunity right now to just give us a bit of a steer, because this is something we've been thinking about in the conversations about this topic, and it would be very helpful to know that if people on the call support the idea of putting a commission together, or if it's something they think would be nice, but not necessarily transformational, which is really what we seek to achieve. So if people can complete, and Patrizia, if you'll keep an eye and let Candice know when she should share the results.
We are at 50% of answers. So I will keep it open a little more to encourage the rest of the participants to respond.
And in the meantime, what I'd like to do is there's some very, the less so in the chat, but more so in the Q&A, are some really spicy contributions. And the one that I settled on was actually from the same person, JP Gutierrez, who asked the question about the Lancet Commission. But JP Gutierrez was saying, while increasing leadership by countries is clearly needed, it also poses a challenge to the independence of evaluations. Avoiding evaluator capture by global organizations is already hard, and that may be exacerbated when countries lead the agenda. So what do the panelists think? Because for me personally, I'm surprised at the focus on independence. I think sometimes as an evaluation drone, I take independence for granted. But what do the panelists think about how to enhance the independence of these evaluation systems?
Thanks, Dugan. I think also just to add to that before the panelists come in, Corday is also asking a question on independence. He's saying, as the total independence of evaluation is a tall order in practice, what can be considered an acceptable level of independence, and what can evaluation do to improve its independence? So let's run through the same order as before. James, your thoughts on independence?
So thanks, Candice, and thanks. I feel really not well able to address this. I mean, a bit like Dugan, I've been intrigued, I think, by and have learned a lot actually through the discussions about different levels of independence. You know, I suppose from I think I'm probably just going to parrot things that Nina might say, because I think being clear when independence is needed, being clear what we mean in any given situation. These things are absolutely critically important. I frame them, I suppose, a little bit from a researcher's point of view. I want to see the method. I want to see the data. I want to understand how the data were analyzed to give rise to the conclusions. And, we see bias. Bias is a constant threat to all investigations of any type, and it can come deliberately, but more often can come non-deliberately. It comes from many different sources. And as I said earlier, when I think about rigor, I'm trying to think about reducing bias, and one of those things is understanding the perspective of the people who are asking the questions, the people who are answering, and the environment they're in. And so that's a very sort of researchy, methody answer. Total independence seems very hard, and whatever that may mean, and as some people pointed out, for learning, you can get really good processes that generate learning that don't need independence. So being clear where you really do need independence, and if we really do, then I think that probably is a big question for whether or not the current setup of evaluation structures, can give that, if that's really what we need.
Thanks, James. Let me also say that not all panelists have to answer all questions, so I'm not going to necessarily run through everybody, but let me offer to all panelists, whoever would like to answer the question on independence, but let's hold your thought for now. And I'm going to take you immediately once we've looked at the poll. The poll results are in. Dugan, do you want to talk through them?
Yeah, thanks. So 68, a good solid 2/3 of the people on the call think a Lancet Commission would be helpful. Only 2 votes of the 22 cast said no, which I would be interested to know why they don't think it would be helpful. Maybe they think it would just be a big waste of time and money and people blundering around, flying about. And then some people weren't sure. They just said, I don't know, maybe not. I guess it depends on making sure that the commission has got a good brief. But I'm very heartened by the 2/3 who think it would be good. I think that we do have to take very seriously this request that the commissioners and the participants in the process not be the usual crew. But this is helpful and it's very interesting. And thank you for the poll, Patrizia. We'll bear that in mind. And back to you, Candice.
Thanks, Dugan. And hopefully we can come back to that as another question to the panel as well. I think it's very interesting, especially those 2 who said no. We'd love to hear from you. John, you had some thoughts on independence. Please go ahead.
Yeah, thanks. And I also don't have the answer. I think it's one of those things that's a constant work in progress and a constant sort of checking yourself, as things roll out. And I think Nina's also done a lot of review of this, certainly in the context of working with us. And I think through, at least our thinking is evolving a bit, but really if you look at sort of 3 categories around independence: operational, technical, and behavioral, and thinking about what are the sort of key ingredients around each one of those categories. And I agree that it's not always independent. And I think Nina's point is well taken in terms of being careful when we're labeling something independent when it actually has huge dependencies. I think that's an important point. But I'm drawn to my previous role at WHO was to oversee the development of WHO's guidelines for the organization. And there are a lot of analogs there in terms of there are parts of that process where there's a black box, so to say. We know what's in the black box, but there's a moment where there's supposed to be, good data, rigorously collected, rigorously analyzed, and brought together for consideration. And that's not to be tampered with. That's supposed to be done very well. It's supposed to be done with high credibility. It's supposed to be done in a way where people can collect it without interference, with having full access to the people they need to have access to. And it's the same for evaluation. But around that sort of black box, there's a whole political circle, right, going on, or a political meaning not necessarily negatively, but dealing with people and weighing views and perspectives and weighing people's valuing of the different information that's coming through. So I think recognizing what parts of that are kind of can be a bit of the sacred box where you've got the credibility standards, the quality standards, the rigor standards, the ability to work freely, access to information, and then recognizing those parts that are more in the public domain and for discussion. So it's not completely clear, but I think if you look across the process, you can identify those points where you need to be more protective or less protective or more discursive versus more closed off in terms of research. But a few thoughts on
that. So it's not necessarily an either independent or not, but more on a continuum and contextually defined, I suppose one would say. Nina, your name came up a couple of times around independence. Your thoughts on that?
Yeah, I struggle with this, and it's something we've all worked on for a long time. And I think we started in the 2000s with the original evaluations, sort of. And I told this story at a seminar that we had together, where many of us were there. But the first Gavi evaluation, and I see Abdullah Bashir is on this call. The first Gavi evaluation was done in the first 5-year period. Gavi was founded in 2000. I came in 2007, and they were still doing that evaluation. And it was kind of stuck, and it was long, and it was big. And by the time we got it, it was truly irrelevant. And then Peter Hansen sort of and Abdullah innovated, and JP, who's also on the call, and I'm sure others, with this sort of idea of real-time evaluation. Let's try real-time evaluation. And that didn't work either. So I think everybody's tried a number of solutions, but I still don't think we're there. And I'm involved with a few global health organizations now, and I wonder if we shouldn't go back to sort of an audit function again and give evaluators the same kind of gravitas and access to information that they give to the auditors. The auditor at the Global Fund has full access to any bit of information they want at any time, and evaluators have to sort of putz around or tiptoe around to get what they want. So I do wonder and maybe this is something that Lancet Commission could explore. Is it time for an evaluation group which is set up and funded to evaluate what it wants to evaluate for Gavi, the Global Fund, CEPI, and throw in a few others, because they also have an interconnectedness, all of these. And I think there's a sort of a false line between, oh, we're just doing the Gavi program, or, oh, we're just doing the CEPI program, can't touch the other, when all these organizations work together. So I would be interested in part of that commission exploring a new model whereby it's sort of a joint independent evaluation office funded, staffed with professionals, and can go where it wants. And I recognize that learning may suffer, but back to the points that John and James and Peter have made, maybe we don't need an evaluation for everything, and where it has more of a learning tie, it doesn't need to be independent, and it wouldn't need to go to this group. But this group can say, we want to dig here or there, and we're free to operate. So that would be my radical suggestion.
I think very radical to me is the potential that you could liken evaluation to audit, which is, something we always say, evaluation is not audit, but I hear what you're saying. It's the gravitas with which it comes into that space. It often happens in countries as well that when, some kind of monitoring or accountability reporting is located in a Ministry of Finance, it's got more gravitas if it's underpinned by sort of, treasury regulations vis-a-vis something else that's just for learning. So I think these things are always in tension. I could add
just one point to that, is that I think we've learned what's bad about audit, but what I find most enticing about the audit is the freedom to operate and the freedom to ask questions without being unfettered. I know it's often disassociated. It shouldn't be policing. We all know evaluation shouldn't be policing, but they have a freedom to operate that we're not given as evaluators. And I find that very attractive.
Absolutely. Thanks so much for that, Nina. I'm trying to also at the same time look at the chat and see what other interesting questions are coming up. There's one around information needs in countries. And again, to participants, you are welcome to raise your hand if you'd like to voice your comment or question to the panel. But let me read out this one. Can the panelists expand on the information needs of the countries in which evaluation is conducted? Specifically, how can we ensure that findings reach the right people, that the format of the findings are in a manner that stakeholders can understand and take action, and that they reach the stakeholders on time, and informed action on the issue. So who would like to have a go at that one? I'm going to pick on Peter because he hasn't spoken in the previous round.
Sure, Candice, happy to come in, and I had a feeling you might do that. Yeah, I think the question is a really important one, and it brings us down to the brass tacks and the concrete actions. And so my mind is going back to some of the themes from the first segment here, where panelists were responding to the questions that you posed, Candice. I mean, I do think from my side, I'd like to come back to the theme of country leadership and voice here. I think that was the starting opening frame of the question itself. I think we have to ask questions. We have to ask countries. We need their voice, and not a passive voice, not a secondary, tertiary voice. I think it should be a voice in a leadership role. And maybe just to take one example, right? This part of this conversation is centered around evaluation of global health institutions, right, and how they can contribute towards the goals articulated in the SDGs. So I think that maybe lends to thinking about examples about evaluations of global health initiatives, strategies, or operating models. I think instead of having the agenda defined by people sitting in high-income countries to say, well, I think this issue is important, I think we should be looking at that, and having that drive the agenda, can we revisit the power dynamics? And actually, I think it ties into the first question also after the panel is what do countries think about that, right? What do ministers of health or implementers at country level, what do they think? What are the parts of the strategies or the operating models of these institutions which they find work well and are supportive of the long-term change that they're trying to lead? It is their populations, their programs, their systems. Some of those resources are going through Treasury, financing their own work programs. Some of those investments are bypassing those systems. What are their perspectives around the key questions, and what changes within the architecture and the way of working would unlock more benefit now and in the future in a more sustained way? I think we need to revisit who is calling the shots and whose voice is prevailing at what steps in the process. That's obviously not the only element at play, but that's one I'd like to highlight. Thanks.
Yeah, and that's something that's quite close to my heart, as the organization that we, the work that we do as CLEAR is in, having countries actually lead and own their own evaluation processes. And I'd like to ask the other panelists to also respond to the same question, but also add on my question, if I may, just on what kind of pushback is there on what Peter was talking about, focusing on country ownership, country leadership in their own processes of development and in their own evaluation. Who would like to take that one? Okay.
So I'm maybe going to build on what Peter said in response to the previous question a little bit on, and just slightly to repeat myself, but because I agree with everything that Peter just said, but I just kind of want to again, highlight, and again, I think this is something that a commission type process could look at, the potential for these global health financing institutions to foster an environment across the whole theory of change, from the raising of money and the financing instruments through to the policy decisions and the programmatic implementation and how communities are engaged and how that hits health system. That whole theory of change is the need for evidence and learning about doing things better throughout that whole chain is immense. And I just think there's a sort of big level question about whether or not we really want these kinds of institutions to kind of grapple with that being a core component of what they're seeking to achieve, about trying to foster learning throughout the system so that programs are getting better. And so it's it's certainly not just about kind of ensuring that evaluation findings hit countries. It's definitely, as Peter says, about fostering leadership in all stages of the process. But I think it's kind of even bigger than that. It's like, do we want to make this part of the mission, this support to and fostering of critical inquiry and learning across the system. And, my vote would be for yes.
Thanks, James. Anybody else? John, any thoughts? Nina, any thoughts? Okay, we can look at, oh, John, please go ahead. Yeah.
Yeah, I do think I think two pieces. One, the leadership aspect just for evaluation in general is really important. I mean, that's one of the shifts that Global Fund has tried to make in terms of where the evaluation function sits within the organization. And I do think we're having more success getting access to information and data than before. But not in the sort of audit sense, and the compliance piece isn't really there. And so that's kind of the gray area. And I think the other piece is just good consultation. It depends on the model. I think I really admire the GFF model as really the country-led evaluation process and that engagement. We're structured very differently in terms of how the evaluation decisions are made, but it is driven by a highly consultative process that occurred early on in the scoping. So throughout all of our coordinating mechanisms and committees looking at topics and utility and the prioritization of those topics. And so there's that specific piece. And then making sure that the teams that are working with countries that are chosen across the portfolio for our larger strategic evaluations, that there is proper engagement at the country level. But I do think it varies by model and what's the recipe for what's the remit that the boards or committees have given those functions as well. And so that kind of local country engagement ownership we need to think creatively about how that comes in different forms, I think, because for us that is a challenge depending on the structure of what we're seeking.
So it sounds as if the sentiment is there and there is an intention, or the thought is there that this is a good thing, this could be a good thing, but possibly institutional structures and forms and contractual arrangements and those kinds of systemic issues sometimes prove to be the obstacles, even though there's the intent to do things differently. Dugan, your thoughts on that?
I don't have thoughts on that. I have other thoughts. May I share my other thoughts?
Please go ahead. Yes.
One of the things I find is, as somebody who's a relatively recent arrival at the World Bank, and whose background is in fact working in country governments and in regional entities and private foundations, is I'm always struck by how evaluation reflects the nature of the institution that's undertaking it. Do you know what I mean? Like the way the World Bank at the Independent Evaluation Group does evaluations reflects the nature of the World Bank. It reflects its culture and its tone, and very much is determined by the interventions that are being evaluated, what get called the evaluand. And so I find myself reflecting on how, if we want to change the way evaluation gets done in the global health institutions, the global health financing institutions, what that says about what needs to change within the global health financing institutions themselves. Do you know what I mean? Like, not just in relation to how evaluation happens, but in relation to how, as James put it, across the theory of change for the intervention. And I'm reflecting also on some of the chats that I see in the Q&A. The one in particular that said, the speakers have raised important points. It's somebody called Fode Touré. The speakers have raised important points, especially on mindset changes of evaluation stakeholders. What do the speakers think on how to engage with stakeholders who are likely to be negatively affected by an evaluation? And for me, that's so interesting because right now my program is being evaluated. I'm about to be evaluated myself. And I can tell you it's a disgusting experience that I absolutely loathe and handle very, very badly. And there's definitely a set of, I would say, emotional skills or like a level of maturity that I do not have, and which I think many of my colleagues and my peers do not have. So I reflect on that. And the last point I want to make is When I think about evaluation in 50 years, I wonder if it's going to be called evaluation. I noted that when people were talking, they called it evidence and learning. They don't always call it evaluation. Maybe what we're talking about needs to be rebranded and retitled and reimagined in ways that give it an opportunity to shed the constraints of the way evaluation has been done historically and call it something that is more inclusive. Obviously, for people like us who come from a developing country context, the big question is around monitoring, because many country governments absorb, they invest enormously in monitoring and very little in evaluation. And so that kind of data doesn't get treated as helpful as it might. But I'm wondering if what I've said resonates with any of the other speakers, and just thinking that we are coming close to the end of our time. Back to you, Candice.
Thanks. I think that's very provocative, Dugan, and I'd love to hear from the panelists on that. Because I think, John, you mentioned in the beginning about the value proposition for evaluation, right? And for those of us in the sector, it's one of the hardest things. You've got to constantly proving your worth and proving the value of the work that you're doing in evaluation, the value of evaluation itself. What Dugan's talking about it's so much harder when you have a negative message or a difficult message to carry. How do we navigate that? What are your thoughts on what he's just shared with us? Maybe, John, I could start with you.
Yeah, no, it's an interesting query. I mean, it's sort of a double-edged sword in terms of the labeling, right? So if we shift to evidence and learning, that almost sounds too much fun, right? We don't have the then you lose the forza, right, of we're the independent evaluators and we need access to your records, and so it's a set of trade-offs. Well, I'd rather be on the evidence and learning side. I think there are ways to maybe communicate that differently within organizations, because I do agree that we have a toolkit, right, and it's evidence and learning by and large, and one of the tools is independent kinds of evaluations, another tool with different kinds of reviews, and et cetera. So I think there could be an opportunity to reframe that. I mean, it is part of the rationale of the way Global Fund has changed its setup, and it's in my title, and sort of how we're trying to bring those things together. I think I'll let you know how it works out, and we will also be audited next year, Dugan. So I feel your pain, but it's important that we look and see if it's working. I think the other piece is around. So I think on the rebranding, I think there could be some ability to do that, as long as we're really clear in what we're talking about. On the sort of mindset issue, nobody really loves it. But I guess what we're trying to find, that sort of piece between the piece where we have to do for the question and the accountability piece that we've got from the strategy committee or our board, and then the great interest and excitement from the program team to really look into something as well. And so finding that overlap is where you kind of get, I think, the special sauce, so to say. And then I think that the other piece is a no surprises kind of approach, where here's what we're doing, here are all the questions we're asking, here's the preliminary insights that are coming in. Some are not sounding very good, some are really amazing, and really the sort of no surprises culture. And we have debates within our team about what does that really look like? Well, do we send all the questions to all the key informants beforehand? There are strong arguments that we don't, catch them by surprise. Strong arguments that we absolutely do, so that they're prepared. And so we're sort of leaning on the let's make sure they're prepared side of things, so that it's not a surprise culture. So a few thoughts on that, but it's an art, not a science, I think.
I think that's the most perfect description. It's an art, not a science. James, I'm going to put you on the spot because you teach this. What do you tell your students? How do you do this?
I tell them it's a science, not an art. It is a flippant response, but there's an element of truth in it, I think. And as John was, I mean, of course there is an artistic, and I was trying to think of when you came to me what I might say, and maybe on the art side, trust is an enormously valuable thing throughout the system, and you can't be entirely reliant on trust because difficult questions need to be asked, but trust is a valuable, trust and humility are kind of valuable things on the art side of things. But I guess I'm just going to revert a little bit to type and go back to methods and the science argument, because it just, sure, it should be an art, but it should also be about the data and the way in which the process is undertaken and the clarity of questions asked, the transparency of the data collected, the understanding of the analytic or inferential process applied to those that gives reads. These are the things that I lean to and teach my students about as a corollary to working in environments and being humble and building trust. And yeah, I am sure that there is work to do to continue to strengthen that that line between the data that we collect and the questions that we ask and the inferences that we make from them. I see that everywhere for sure.
I love that you mentioned humility, because interestingly, I talk about humility a lot as well. I think that is really an important characteristic to carry into the space. We've got 2 minutes left, and I wonder if I'm going to be cheeky enough to ask the panelists to just take 30 seconds of all the amazing proposals and recommendations you had today. If the Lancet Commission happens, what were the top 1, 2, or 3 things do you think they should focus on? And I'm going to start with Pete and go backwards.
I'll go with independence, leadership, including, of course, country leadership, and timeliness and approach with attention to feedback loops and how that is so critical for utility and ultimately value.
Thanks, Peter. You're getting a lot of love for that. I think there's a lot of support for that. Nina, your top 1, 2, or 3.
Yeah, I agree in full with Peter's, and I think there's something around context. I think we've entered a world where everybody has to get an A+ all the time in everything, and any kind of thing that doesn't contribute to the A+ is seen as bad. We've had a huge global grade inflation, not only in American universities, but I think globally. So I think we have to look at context and think about the context of criticism, constructive criticism, and see how that changed and place evaluation within that larger cultural context.
A lot of love and support for that too, Nina. Thanks. John, your thoughts?
Yeah, I think sort of agreeing a lot with Nina as well. Really the placement of evaluation within general decision-making processes, and should not shying away from the political element of that. I think finding some good examples where indeed political obstacles were either exposed or dealt with or redirected in the context of a programmatic evaluation or strategic evaluation, and having that discussion would be good. I think the other piece is use of technology, sort of back to what I said earlier. How can we optimize processes with more systematized reviews of the existing evidence, how those things can fit into answering our questions without using resources that we could use on BedNets or other big questions.
Thank you, John. And the final word from you, James.
Thanks. I mean, I agree with my colleagues. As we've done here, and I, have found ourselves doing since I entered this world, we often talk about this word independence at many levels and meaning many things. I think, that would apply, but would need to be particularly important for a Lancet Commission to be useful. It itself would need to be radical and independent, and really open the box to be useful and think hard about what are the options in this space. And so that's one thing I'd want it to be. The second is, as I go back to my research roots, I'm intrigued, I remain intrigued by the fact that we're, these different activities things that happen in universities, things that happen outside universities, things that happen in this space that we talked about today, for me, they're all part of this same theory of a change and inquiry from beginning to end. And my hypothesis going into it would be that there would be enormous value in seeing connections between these different parts of the universe, and I'd want it to focus on that as well.
On that note, I'd really like to thank each one of you. Panelists, you've been absolutely amazing. This has been thrilling. I really enjoyed this session. I'm sure the participants feel the same way. The chat and the Q&A has been on fire today. Thank you so much for your time. We'll keep our ears and eyes out for that hopeful Lancet Commission. And thank you so much for your time today, everybody. Fantastic conversation. Take care. Goodbye.
Thank you, Candice.
Thank you,
Thank
Candice.
you.
Wonderful.
Thank you so much.
Thank you, Candice. Excellent
Thank you.
moderation. Thank you so much. Bye-bye.